Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about Frederick's new adolescent clubhouse known as On the Mark. And our special guest is Kristen Cravath with the Adolescent Clubhouse, now known as On the Mark. Kristen, welcome. Thank you for joining us.
Thank you for having me.
All right. Well, I bet everybody's wondering, what is an adolescent clubhouse? Let's start there.
An adolescent clubhouse, it's a new, innovative, evidence-based after-school activity center. We provide support and structure for youth who want to stay away from environments where there's nicotine or alcohol or other drugs involved.
So it gives them something else to do. All right. Where is the clubhouse located?
We're right downtown at 520 North Market Street. We picked this location because it's close to two different Frederick high schools, a bunch of different other service providers and partners.
Okay. And who can participate in the programs at the On the Mark Clubhouse?
We are open to youth ages 12 to 17, youth who have a substance use disorder or other, such as nicotine dependence or other co-occurring disorders, and we're also open to their families as well.
Okay, so that's great. You're open to the families. So tell us about what the hours are then.
We're open Monday through Saturday. Monday through Friday, we're open from 3:30 to 7, and on Saturday, we're open from 11 to 5.
That's great. Saturday hours and pretty late evening hours. That's very helpful for parents who are driving down the road or to another county for work and to be able to pick up their kids.
And we'll be open in the summer as well.
Okay.
So all year round.
Terrific. And how did the program become established, or why was it established?
So the Alcohol and Drug Abuse Administration is piloting the Clubhouse program in 7 different counties, and it's based on a program that's currently in the state of Georgia.
And I understand that you recently had an open house. Can you tell us about that?
We did. We had our open house on April 16th. It was a huge success. We had 70-something people come in from the community. We made some new partnerships. We pronounced our new name, or unveiled our new name, our new logo, which was created by one of our clubhouse members.
Wow, how exciting for him.
And since then, our membership has actually doubled. So just in about a week, our membership doubled.
Oh, that's great. So you mentioned that this program is modeled on an evidence-based program, which means that that they have good outcomes, and that they have evidence that what they're doing works. So it might be a little bit too early for you to be able to say whether you've had any successes that you'd like to share.
We have had successes. One of our members, he has been coming and diligently bringing his chemistry homework, studying every afternoon, and since then his quiz grades have improved to 100%. His mom has expressed how she's seen a change in him. It's been a huge success for us.
Wow, that's great. In such a short time. That's great for that young man.
Yep.
All right. Well, let's see. So how about any barriers that you've discovered so far?
One of our barriers is transportation. We can't provide transportation to and from the clubhouse, but we're looking to see what other counties are doing to hopefully improve on that.
Okay, all right. Well, that's great. So we know that there's more to keep looking out for, so some additional improvements and enhancements, although the hours certainly do make it a little bit easier for parents who have transportation to be able to help pick them up. But that's terrific.
Thank
all
you.
right. Well, I hope now that you've been on and more people know about the Adolescent Clubhouse, that both they'll refer adolescents there, their families, and maybe some people have some skills that they'd like to offer to volunteer.
Absolutely. And we're, as I said, we're open from 3:30 to 7, and people are welcome to just drop in. No need to call us, and you can sign up for membership or become a volunteer.
Okay, that's great. And Saturday hours too, and then in the summer. We'll look for the summer hours. Great. Well, thanks a lot. Thank you for joining us.
Thank you so much.
And now please stay tuned for this month's Medical Myth.
The Frederick County Child Advocacy Center focuses on child abuse awareness and prevention. The emphasis is on the importance of preventing child abuse and neglect. The Child Advocacy Center works to help children reach their full potential in a safe and loving environment where they can thrive, develop character, and learn to be responsive citizens. Join us in making a positive difference in the life of a child and bringing a brighter future for Frederick County. For more information, visit www.frederickcountymd.gov/CAC or call us at 301-600-1758.
The Frederick County Division of Parks and Recreation and Frederick County Public Schools are now offering swimming lessons for all ages at the Walkersville High School pool. Classes include parent and child aquatics for 6 months to 3 years, preschool classes for 4 to 5 years, youth learn to swim classes for 5 to 14 years, and teen and adult classes. For more information on these classes, please call 301-600-2936 or log on to recreator.com. We'll see you in the pool.
The Frederick County Meals on Wheels program delivers nutritious meals to homebound seniors and others who can't shop or prepare foods on their own. Sometimes the only smiling face a senior may see during the day is that of a Meals on Wheels volunteer. With almost 100 on the waiting list, the program needs volunteers and individual donations, as well as corporate sponsorships to supplement government funding of the program. Please call the Department of Aging at 301-600-1605 or visit our website to find out how you can make a difference with your thoughtful support.
Many volunteer opportunities are available on Frederick County boards and commissions. Whether the Commission on Aging, Human Relations Commission, the Solid Waste Advisory Committee, Workforce Development Board, or many others, the Board of County Commissioners welcomes your participation. Those desiring to serve must be residents and registered voters of Frederick County. For more information, contact Joyce Grosnickel at 301-600-1102 or by email at fcgboards@frederickcountymd.gov.
And now here's this month's Medical Myths. Welcome to this month's Medical Myths. This month's Medical Myths is about high blood pressure from the American Heart Association. The first myth is thinking that if high blood pressure runs in your family, there is nothing you can do because you will get it too. Well, that's not true. High blood pressure can run in families, and if your parents or close blood relatives have had high blood pressure, you are more likely to develop it too. But lifestyle choices have allowed many people with a family history of high blood pressure to avoid it themselves. Lifestyle changes you can make to prevent it include eat a better diet, which may include reducing sodium, enjoy regular physical activity, maintain a healthy weight, manage stress, avoid tobacco smoke, comply with medication prescriptions. If you drink, limit alcohol. The second myth is that if you don't use table salt, you are in control of your sodium intake and your blood pressure won't be affected. In some people, sodium can increase blood pressure, but controlling sodium means more than just putting down the salt shaker. It also means checking labels, because up to 75% of the sodium we take in or consume is hidden in processed foods like tomato sauce, soups, condiments, canned foods, and prepared mixes. When buying prepared and prepackaged foods, read the labels. Watch for the words soda and sodium and the symbol Na on labels. These words show that sodium compounds are present. A third myth that I just heard the other day was the belief that if you use kosher or sea salt when you cook instead of regular table salt, you are using a low sodium alternative. Chemically, kosher salt and sea salt are the same as table salt, 40% sodium, and count the same toward total sodium consumption. Table salt is a combination of the two minerals sodium and chloride. The final myth is that if you feel fine, you don't have to worry about high blood pressure. That is a dangerous myth. If you wait until you feel like you have high blood pressure to get it checked, it could be too late. It is often called the silent killer. Get your blood pressure checked even if you feel okay. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's tip is brought to you by the Substance Abuse Prevention Services Unit of the Behavioral Health Services Division. The end of another school year signals prom and graduation festivities for nearly 3,200 seniors in Frederick County. While most students will not drink alcohol during these festivities, some will choose to drink as part of their celebration. This is a concern because underage drinking can interfere with school attendance, disrupt concentration, damage relationships, and potentially alter brain function and/or other aspects of development, all of which have consequences for future success. When it comes to risky behaviors, including drinking alcohol, young people often perceive that everyone is doing it. The good news is that most youth don't drink alcohol. According to a recent survey administered to over 900 youth ages 10 to 25 as part of the Frederick County Alcohol Prevention Initiative, 73% of Frederick youth responded that they did not drink alcohol in the past 30 days. To encourage a safe celebration season, the Centers for Disease Control and Prevention offers these tips for youth. Say no to alcohol, smoking, drugs, and sex. Don't drink and drive, and don't get into a car with anyone who's been drinking. Make sure parents or guardians know where you are at all times in case of an emergency. Call a parent, guardian, or someone you trust in case plans change or you need help. Remember to have fun, but stay safe. Parents, you have influence on your teens' decisions to not drink and use drugs. Talk to your kids about the risks and consequences of underage drinking. Let your children know that you're there to help them handle any challenging situation. Keep your children safe during prom and graduation events by knowing where your children are and who they're with. Check in with them via text. Do not provide alcoholic beverages to youth. It's against the law for anyone under 21 to drink alcohol. For more information on how to talk to your teen about alcohol, visit timetotalk.org. If you are concerned about a suspected party involving underage drinking, parents and youth are encouraged to contact the Underage Party Tip Hotline at 301-600-1318. Simply give the address of the party, the time, and the date. Callers are not required to give their names, and all information is confidential. Thank you for tuning in to this month's Health Tip and for doing your part to keep Frederick County youth safe.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.
The Frederick Board of County Commissioners invites you to watch live and archived broadcasts of county meetings. Simply visit the Frederick County Government website at www.frederickcountymd.gov and click on the link to watch FCG-TV live or the link for FCG-TV archives. You can also save time when viewing a previously broadcast meeting by locating the agenda topic of interest and clicking on that item. The broadcast will then start at that section. These website tools are designed for the convenience of our viewers and to improve access to county government open meetings. And did you know that you can watch FCG-TV on your mobile devices as well? For more information, visit www.frederickcountymd.gov/FCG-TV. Frederick County Workforce Services and its partners are proud to support Frederick Works, one job at a time, an employer hiring initiative that encourages Frederick County businesses to create or fill at least one new job to boost our local economy. So far, the initiative has tracked over 1,500 jobs. There's no cost for employers to participate, and the benefits of joining include positive community recognition and free publicity. Visit www.frederickworks.com/onejob for more information.